So this is Biomech Group 16 ACL injuries and the biomechanics behind them. I'm Jack Mead.
I'm Julia.
I'm Sarah.
The ACL, or the anterior cruciate ligament, helps to stabilize the knee by preventing tibial rotation and the tibia from over-translating too far in front of the femur. In sports like soccer and football, actions such as running, jumping, pivoting, and changing directions can cause such motions that put stress on the ligament. As such, ACL injuries are one of the major risks faced by athletes across the world. Damage to the ACL will cause a decrease in knee stability and could further damage the knee joint if not treated properly. Understanding the biomechanics that undergo ACL injuries will help in understanding its function and identify preventative methods to keep you in the game.
The biomechanics of the ACL injury. So the most frequent mechanism of injury is a non-contact combined valgus and internal rotation trauma. So you can see the tibia is rotating internally, and we have a knee valgus kind of X looking position. In layman's terms, this means that the upper leg rotates while the foot and lower leg are planted. Gait Analysis of biomechanics reveals that at-risk patients are observed to have increased knee abduction loading and decreased knee flexion angles. High knee abduction moments are a common risk factor for ACL tear. They are frequently observed in girls due to the knee valgus. More on knee valgus. Athletes with higher knee abduction motions are at higher risk for suffering an ACL injury. Good alignment that we're looking for is a neutral alignment between the hips, knees, and ankles. Whereas with knee valgus, we have more of an X looking position with the legs. This is increased angle between the tibia and femur that leads to a higher moment. The ground reaction force between the ground and your foot, combined with the weight force generated by your mass and the angle create a higher moment about your knee, generates larger forces there, which coupled with jumping, running, and cutting, athletes who display knee valgus are likely to suffer an ACL injury due to knee valgus collapse. A popular, widely known athlete who suffers from knee valgus is Zion Williamson, and this is part of why he has been so injured for the early portion of his career.
Due to many factors that could cause an ACL injury, there is no one direct prevention method. However, the strengthening of muscles and practicing a proper technique through certain exercises can help lower the risk of an ACL injury. As such, several prevention programs have included exercises that focus on refining technique and control of basic motor skills and the strengthening of muscles to reduce the risk of injury. Such technical exercises include running from line to line, shuffling from side to side, and strengthening exercises like lunges, squats, and hip abductions. Other exercises that focus on flexibility, agility, and balance can also help in improving body muscle and control, like calf, quadricep, hamstring, and hip flexor stretches and single leg hops. The most important factor is to focus on performing the exercises correctly. Incorrect techniques will lead to greater chance of injury.
So after an ACL tear, most undergo ACL reconstructive surgery to help prevent further knee damage. This surgery uses a piece of your patellar tendon to reconnect the ACL. After surgery, they start an individualized and progressive rehab program. Rehab first focuses on range of motion to ensure the athlete can perform full knee extension as soon as possible. Prolonged calf stretching can really help with this. Next is to allow the knee joint to adapt to bearing increasing loads. Therapies like underwater treadmills, which allow for gradual increase in weight bearing on the knee, work in the sense that the higher the water, the less weight the knee bears. So as your rehabilitation progresses, the water will get lower and your knee will bear more weight. Up next is strengthening the knee. Start with some isometric exercises, like applying a force to the surrounding muscles while the joint stays in place. This can be seen in the top right picture. Then go on to isotonic exercises, where the joint moves against a constant resistance. Look, you can see this in the bottom left picture. Finally, you have isokinetic exercises, where the amount of resistance varies, but the rate of joint movement is constant. An isokinetic machine is seen in the bottom right picture. Then we have that neuromuscular training, which improves muscle reaction time and knee stabilization, especially when the knee is moving. Finally, we have continued progression. This focuses on going up and down steps of different heights, forwards and backwards running, jumping, agility, accelerating, and decelerating. Finally, after passing all these assessments in areas such as isokinetics, balance, qualitative movement, and more, the athlete may return to sports, but the amount of athletic activity must be limited and monitored at first. 25% of athletes with ACL tears suffer a second tear within 10 years of the first. Proper rehab, not rushing back into sports, and utilizing the ACL strengthening exercises mentioned in the prevention section of this presentation will help to prevent this.
Sports specialization has become increasingly popular and common among today's youth due to the increasingly competitive nature of the game and scholarship opportunities at college. Specialization is linked to an increased incidence of patellofemoral pain syndrome, PFP, Osgood-Schlatter's disease, and a wide variety of other knee injuries. These patellar pain syndrome is also linked to similar traits as the ACL tear, and these result from unequal development of the muscle groups due to one sport working one particular set of muscles. It also results in overuse injuries. We encourage athletes to play more than one sport and don't define yourself by one sport. Lots of UVA collegiate athletes played numerous amounts of sports in high school. Ryan Conrad played soccer, basketball, and lacrosse in high school. Jack Salt played volleyball and basketball in high school. And Charles Snowden played football and basketball in high school. Thanks for listening. Now what are you waiting for? Go outside and play some sports, but do so with proper technique and training.